Well, hello, everyone. Thank you for joining us. My name is Karen Eggleston. I'm the director of the Asia Health Policy Program at Stanford University's Asia Pacific Research Center within FSI. Delighted you're able to join us today. So this is the second in our series this quarter on Asia Health Policy dealing with the pandemic and beyond, public and private roles. And we're delighted to have with us a very special speaker today. Before I introduce him, I want to mention our upcoming events. The final one of this quarter will be on Tuesday, November 17th at the same time, 5:30 Pacific, on chronic disease and COVID. With recently collected empirical data, also from Southeast Asia, Thailand, and Vietnam, as well as two of the largest economies in Asia and on the planet, China and India. And then we'll continue our series on public-private roles in winter quarter. January 28th, we'll have our own Dr. Radhika Jain on government insurance at private hospitals in India. And a keynote of the series on February 10th, so save the date, 11 a.m. Pacific, with Nobel laureate Oliver Hart. We're celebrating the quarter century of the famous Hart-Schleifer-Vishny paper on the proper scope of government. So look at the Stanford Asia Health Policy Program website for information about our future webinars with more rigorous research and also practitioner panels in the future. So today I'm delighted to welcome a special speaker, Dr. Sudarno Sumarto, who is an economist specializing in poverty reduction, social protection, and many other areas, health, but also education, labor, political economy of public policy implementation in Indonesia and beyond. Before joining the national team for the acceleration of poverty reduction, he was founder and executive director of the SMERU Research Institute and was a visiting scholar here at APARC at Stanford several years ago. And he collaborates with many other colleagues also within FSI. And we're delighted that today's webinar is also including our Southeast Asia program partners, and look forward to pointed questions from colleague Don Emerson and other friends and colleagues joining us. Dr. Sudarno Sumarto has a PhD in economics from Vanderbilt University. He leads large-scale research projects, of which you'll hear about today, and produces high-impact research that informs policy, including published in top journals like the Journal of Political Economy, and provides intellectual leadership and other contributions to public policy making in Indonesia. So for those of you joining live, please put your questions in the Q&A, and we'll be getting to those after Dr. Sudarno Sumarto's presentation. Thank you so much for joining us, and over to you. So it won't surprise you to know that our esteemed colleague, Don Emerson, has some questions for you related to politics and the broader scope of many of these issues you talked about. So maybe I'll ask them together. What effect will the pandemic and the government's response have on the outcomes of the 9th of December regional elections? And how, if at all, have the pandemic and the government's performance with regard to it affected opposition to the omnibus bill?
Okay, thank you, Pak Don. How are you? I hope you're well. Good to hear from you, at least virtually. So I'm not a political scientist, as you know, I'm an economist, but maybe I can just have my conjectures about the upcoming Pilkada or regional election with this COVID-19 situation. I think it has an impact in terms of, there are many good cases like Semarang, my hometown. The mayor is very active, very innovative in, fighting COVID-19. It is a very popular. This is actually from the PDIP and also several other places like Salatiga. I'm just talking about Central Java areas. So basically, because now people are not meeting in person in terms of, campaigning is going to be done online, even though some places with bad connection doesn't have enough internet, still very difficult to do it in person. But I think those who are actively engaged with this COVID-19 mitigation scheme will most likely get a better chance to be elected in the upcoming Pilkada election. I can tell, like Ganjar Pranowo is very famous, but he's not seeking for re-election. He's still a couple years coming from here. And that's the three famous governor, Anies, Ganjar, and also West Java governor Emil. The second question was, what was the second question, Ibu?
How, if at all, have the pandemic and the government's performance with regard to it affected the opposition to the omnibus bill?
Yep. Okay. Yep. Okay. This omnibus bill is actually, in terms of the timing, actually, I review it, especially from the economic point of view. There are some good things in that omnibus law. But of course, I think the issue is about how can we communicate it better and, having more discussion early on before it's being passed. So government is having tough time. As you know, there are a lot of demonstrations, sometimes very, very, very bad, took place in many places. So I hope that the government will be able to, communicate better and also explain in terms of the government regulation following that omnibus law. But I understand a bit very depressing time when we are still fighting with COVID-19. At the same time, people were actually debating everywhere about this legacy of, or the process being put in place of this omnibus law. So I think that's what I can tell in terms of, it's weakened the government, definitely weakened the government capacity in terms of responding to the COVID-19, as we should have been focusing more of our time to mitigate this and to put, all of the program in place to improve our absorption. There are still many line ministers who did not absorb that much budget. This is almost closing year. Some line ministries only absorb less than 50% of the government budget. So the issue is not about fiscal capacity of Indonesian government to spend in terms of mitigating the shock, but it's in terms of the innovation. As I said from the beginning, Indonesia need to be more innovative in terms of how can we spend better, smarter, to get economy back into the move.
Great, thank you. Another question that has come in from an Ambler. Sometimes it looks as if the economy and infrastructure are the main or the only government interests, how do you view the chance that the lack of cooperation among politicians and civil service that you mentioned are two of the major challenges will improve in the future? Do you think there's possibility for improvement? I might add, if so, how can we promote that?
Yeah, that's an interesting question. That has been the critics. We focus too much on infrastructure. Now, well, we are, we suffer a lot, human suffering coming out from this crisis are huge. And people didn't even think about, sometime I travel back and forth between Semarang and Jakarta by car, and, the toll road is empty for the last 6 months when I travel back and forth between Semarang every week, because I still have to be in Jakarta meeting. You can do it sometime virtually, but sometimes we also have to meet in person. So people now rethink about what should be the priority from now on. And how can we, I think the lesson is, yes, infrastructure is definitely important. That's what we have been saying all along, myself included, because it was a lot of bottlenecking in the past, and it doesn't help poor people to sell their stuff because the connections were very bad in terms of marketing of their product from the villages to the cities, and now it's being improved. But during this rule now, we realize the importance of, how can we work better in the future, and how can we invest more on human capital and also social protection put in place, so when the shocks like this happen, people can survive for a couple months or years at least. So you can see from the way how people are coping with, many of them, about more than 70% are reducing their food consumption. That's huge. Even though over time it's declining, but at that time people are suffering just to meet the basic necessities. And that impact on poverty of increased by about 1.3 million new poor was only during the first quarter of the pandemic, when the economy still grew about 3%. So if you ask me about what is now the poverty, it's hard to tell, because poverty is shrinking, contracted by -5, more than 5%. So probably poverty will have much more than that number. So hopefully in the future we will learn, coming out from that, more have collaboration across the party lines in terms of how can we, that's where the title of my talk is, how can we weathering the storm, and what can we learn in the future? How can we put in place social protection, which actually is also investment, just like infrastructure. This is an infrastructure of human capital. If our children are healthier and smarter, they can compete globally in the future. That's the very idea of putting this health. It's not just free health. The free is only for those who can afford, but those in the middle should be, paying their own health insurance. That's what we did. That's what we are trying to do. We encourage people in the middle with the insurance. Maybe my answer is not very direct, very complicated, but that's what we have learned right now. I hope people will learn coming out from this. Thank you for the question. Excellent.
Yes, thank you for that nuanced and detailed answer. Another question we have coming in is related to the intermediate term or longer term. You talked about the current social assistance in this pandemic. Many places are struggling with that. But the question is, do you think that this will be continuing, or how will it change for next year and future years? So will the budget return to its normal level, or will the innovations continue with additional need for support? Or will they be phasing out of ad hoc programs to a more systematic approach, as you were alluding to? What are your thoughts on that?
Thank you. That's a good question, Karen. Yes, if we look at the budget for next year, I think when I talk with a colleague from the Ministry of Finance and also from the Ministry of Social and also Economic, they promise, or at least they committed to continue putting some of the ad hoc program right now until next year, but remain to be seen. Basically, we will focus, I think the government will continue focusing on the bottom 40%. That's now what we are building with improving or updating the social registry. pre-employment card will definitely continue next year. That's a new program actually. And so electricity subsidy is being expanded until the end of the year. But it's hard to tell right now about what percent of that increase in budget, almost 2.5 times from the pre-COVID-19, will continue to be sustained. But our fiscal capacity is still okay, according to colleague from the Ministry of Finance, but at least this year. But next year, until how long can we go in terms of our fiscal sustainability to keep putting similar budget as this year? But also it depends on how this COVID-19 evolve over time. As you know, now things are looking much better in terms of the economic activities, especially in rural areas. In some areas are actually making some improvement and progress in terms of the economic activities. Yep. So basically, government remain committed to continue, according to my colleague, of continuing some of the ad hoc program. Like, in the past, just to give you the background, the family help program, this is like conditional cash transfer, increased from about 8 million to now about 10 million families. And the cash transfer for the poor used to be, we call it kartu sembako, which basically it's a cash transfer to the household. Now cover about more than 15 to 20 millions.
Great. Another question that had come in related to that, that there's been debate in many places about how to cope with this, controlling the pandemic and its transmission and livelihoods. And you've talked about that in Indonesia. But a question, actually, another one from Dawn is saying, is there a debate about within Indonesia about what you hear in some other places about taking preventive steps against COVID and more kinds of lockdown and restrictive measures, which have follow on, like you mentioned, for education, versus hoping for focused protection and leading to some kind of herd immunity eventually with or without a vaccine? Is that seen as a trade-off, short-term, long-term? Is it much controversy about that? What do you think?
Yeah, that's a very, very good question, Don and Pardon. And yeah, I think this is a lot of controversy in that one. Actually, we didn't even think about, people think that we are heading toward more of the herd community prevention stuff. But actually, I think there must be some way, if we actually disciplining ourselves in terms of, the basic rules of social distancing and wearing masks and wash your hand. I think that's what has been promoted all over the places in Indonesia. And it's been very tough, as you know, maybe you can, follow the news from the Indonesian newspapers about this controversy between the central and local government in terms of the lockdown policies, especially with the government of Jakarta and the central government of, feeling uneasiness in terms of the policy being put in place. But I believe that it's a difficult question. I'm not a health expert, but there are some policies that work really good, in several districts in Indonesia, in Bali, including actually they use this community policemen, not policemen in the sense of being tough, but, educating them and, things like that is actually working. I'm not sure if I answered your question, but it's a very controversial on this herd community thing that people has been telling us about.
Right, the controversies continue. Yes, go ahead.
Yeah, we didn't think that way. I think that's the way to go. I think we didn't think that's the way to go. I think we are trying very hard to make sure that, health is number one, and then as we go along, and then economy will follow.
Right. So stepping back a minute to the broader question, I mean, you talked about social protection and broader issues of human capital or education and health, and that all underpins the broader economy. So you also talked about evidence and bringing evidence to policy and how you might lead to innovation with that. So I wanted to step back and ask you a question about that. As you know, the broader theme of our webinar series is actually on public and private roles, and we have Oliver Hart speaking in a keynote, and you cited that framework in your recent paper in the JPE on private contracting and rice distribution. First thing you cited was Hart-Schleifer-Vishny, and you and your colleagues talked about this trade-off of the issue with trying to implement a social protection program to reach the vulnerable, to do targeting, but to bring more efficiency. But there are difficulties with that kind of contracting out. So I wanted to ask you, that evidence you brought was based on what, 2012 through 2014? Is there more evidence since then about whether the program had continued and whether it's been efficient of high quality? And do you have other evidence that you're working about specific program delivery like that, or even examples of maybe cases that have informed policy and been a success, or cases where the evidence has shown that it hasn't worked so well? Any examples you can provide?
Okay. Thank you, Karen. Thank you very much. So first, this is a very complex undertaking, as you know, but we at the NP2K has been trying very hard to, use research for evidence-based policy making. I'll just give you an example about the success story. What we did was about this contracting out the last mile, we call it. This is a study that we done a couple of years ago, published in the GPA in 2019. You know, the Rice from the Poor program has been in place for about a decade. That was about 1.5 billion US dollar every year, targeted to about 15.5 million households in Indonesia, where the local government, local official, the head of the village distributed rice in their house. So we found that it was not efficient because a lot of leakage, meaning the missing rice, and also usually distributed just equally across the village household, regardless of your welfare status. And they had to pay much higher prices. And then that was based on the discussion with the Vice President Budiono at that time. Can you try something else? What if we allow, citizen or the local business to participate in the distributing the rice? And then we did a so-called randomized control trial in about 600 villages, with 267 villages, something like that, as our pure control. And the remaining, we have this so-called treatment, where we allow village businessmen to, bid for distributing rice in the household. And we also have several sub-treatments, but the bottom line, and in a nutshell, we found that actually contracting out works, even though it's not as big as, what we would have expected. And actually, communities offer much lower price and also reduce transportation costs and increase the quality of the rice that they receive. So that's one example. And since then, actually, the Rice for the Poor program has been transformed right now to actually keeping voucher kind of thing, which is like a kartu sembako, and that card can be redeemed to any store in the village, small shop owned by local business and things like that. That's one that we actually feel very comfortable working with. And the second one is the study that we completed with Annie Frankenstein, with Ben Olken, Abhijit Banerjee. It's now being reviewed by American Economic Review. This is on the health insurance scheme. You know that actually in terms of achieving universal coverage, Indonesia has been working very hard to incentivize people in the middle. We subsidize those in the bottom 40%. The government pay their premium. It's not that much actually, but it's good. But those in the middle, about 20 million and more, are not willing to buy insurance, even though they actually have the capacity to buy. Mostly people working in the informal sector. So what we did was to, giving subsidies to them. What if we subsidize them for the first 1 year, or giving information and things like that? Of the many treatment that we implemented, turned out subsidy works very well. They, after the subsidy, 1 year subsidy finish, and then about 40% of them continue buying insurance. So we call this as an experience coach. So they know that when they participated in this program, when they got sick, they don't need to spend money, and then they continue to enroll in the program. But that's not working really well right now in terms of, government, how can, because we would like still to, enforce and, things like that. But in terms of subsidizing more on that middle, it's not being implemented yet, but we keep promoting that for the future. And then there are many other stories that I listed, but basically we have done a lot of research that, we'll try to influence policy now or also in the future. And also with the colleague from SMERU, which I'm also board member and also senior research fellow, we have done a lot of research during the pandemic. And many of our finding has been adopted by the Ministry of Education in terms of this present time. For example, because, as I just presented on the impact of school closure in Pakistan, the problem is after school came back, children came back to school. So how can we teach at the right level and prepare a different module, giving more of the decentralized system, not adopting the national curriculum where people from left behind families were left behind during the school opening, for example. Sorry, too much, but that's very much. So we are basically continue working on it. Now we are also doing some innovative research to inform policies.
Excellent, very interesting. Well, I want to thank you so much and our audience. And in these very challenging times, I thought I would try to end with something upbeat, if you will. If you were going to say something to young people, Stanford students, but young people in Indonesia and across the region, to what they can do and think positively for about the future, what might you say?
Yeah, okay. I think I'm an optimist. I'm an optimist, and that's my note is, do we know the human suffering? We are all feeling very depressed sometime with the situation, but there is not yet, light at the end of the tunnel, but it's coming, I think. But we have to keep our optimism and, learn as we go along. But I think, again, especially for many, and it's also very difficult now, Karen, of doing research because you cannot meet in person. Everything has to be done online, right? So that's also the frustration that we are having right now. But we have to use, whatever we have in terms of technology to extract information and to inform policies. So basically, remain optimist and be hopeful and keep well. That's my message.
Well, thank you so much. A great example of using rigorous evidence to inform policy for the vulnerable and for all of us. So thank you very much for what you do and for sharing with us.
Take care, Karen. Thank you very much.
Thank you so much, Sudarno. We really appreciate it.